Pathfinder International, in collaboration with Kano State-led Accountability Mechanism, KanSLAM, has organized a capacity building training for Ward Development Committee chairmen across 10 local government areas in Kano State. Ward Development Committee chairmen play a critical role in bridging the gap between communities and the healthcare system. This training is designed to equip them with the skills and knowledge needed to mobilize communities, monitor healthcare services, and advocate for improvements.
The WDC is a very good structure to improve whatever services or whatever intervention at the grassroots level. They can be an accountability officers, but most especially now that the global perspective is now focusing to direct facility financing. They can be a very strong wing to help the system in accountability. If they track the funds that are being sent to the facilities or any intervention that is meant for community residents, definitely there is going to be an improved healthcare service, improved services, improved well-being at all.
The participants were taken through sessions on leadership, resource utilization, healthcare accountability, and effective advocacy and communication strategies to foster better community engagement. Participants had various breakout sessions, group discussions, and presentations, providing a platform for the chairmen to share experiences and learn best practices from their counterparts across the 10 local government areas.
Sincerely, we have learned greatly on issue of accountability, on issue of advocacy, and a lot of things that we have learned that build our capacity. From today, when we finish this program, we shall be new people, and we shall go back to our communities with a new version of new WDC, God willing. Most of the problems we are always having is the authority a WDC chairman has on most of the facilities. The in charges sometimes, whenever they are going to take decision, they take decision alone. But with this, we knew now that we are critical stakeholders as far as this issue is concerned, this issue of WDC is concerned. The spendings, particularly on this accountability issue, before we thought if somebody embezzled the funds, he would be whole responsible alone. But today, with this training, we are made to understand that both the WDC chairman and the in charges, or rather the facility in charges, will be held responsible for whatever crime is done to humanity. I pray, may God help Pathfinder. What they have done to Kano State, particularly on this program, is great. For the past 22 years or 21 years that we've been serving as WDC chairman, we attended a lot of courses and programs. Sincerely, this one is second to none.
An koya mana da zamu abin da ake cewa monitoring and accountability, da kuma abin da ake cewa irin checklist da waye da shoransu, wanda yake dangantaka tsakanin mu da asibiti zamu je mu rinka duba abubuwan da suke faruwa domin a kawo gyara ko a so a wasati. Kuma an nuna mana cewa su in charges din nan ba abokan rigiman bane, mutane wanda zamu bi su a hankali dan amfana da junanmu, domin su masu tafiya ne ba masu zama bane. Mu kuma kullun yadda ka san soja, WDC ya zama kan amala baka bariki ce kai, duk wani soja da ya zo nan zai zo a bashi wifan ko makami dan ya yaki da shi. To saboda zamu yi amfani da wannan damar dan mi nasara duk gyare-gyaren da aka ba mu zami, kuma zamu koma dukkan membobin mu da muke da su a gargashin mu, zamu je mu musu bayanan duk abin da muka samu na karuwa da komai. Wannan abu Allah ka sanya yadda aka koya mana mu rike shi ba tare da ha'inci ba, mu ma mu je mu koyar kuma mu amfana da abin kowa yi. Sannan su kansu wanda suka shirya wannan abin, ina matukan marabar su da farin ciki dan ban taɓa samun sanda aka yi min zaburarwa sama da wannan ba. Shi yasa ita kanta wannan kungiya ta Pathfinder babu abin da zai ce musu wallahi sai Allah ƙara musu alheri, domin ni da kaina na san na ƙara kwarjini, kuma ko mata ne mazabi ina da mutunci da wani abin nan na buri. Alhamdulillah.
Kai kwarai zai tasiri sosai, zai mana tasiri yadda za mu yi alaka da su in charge su din mu, abokan aikin mu da kuma su community din da suka turo mu wakilce su a wannan asibiti. Zai tasiri. Fatan mu kowa abin da ya abin nan ya fahimta ya koya, ya je ya tara wa'annan mutanen, ba wai WDC din kadai ba, har da su community din da suke morar wannan abin nan din. Ya kamata gaba ɗaya za ka tara su domin ka gaya musu ga abin da yake akwai, ga abin da yake akwai, ga yanda za ku je asibiti, ga yanda duk dai waɗannan abubuwan da aka gaya mana ya kamata a ce sakon ya kai har masu zuwa asibitin ba iyayen kwamitin WDC ba.
I learned how to fill the checklist, one, and then I learned part of what WDC are expected to be doing in their facilities. That is very, very important. This training, as it is, I'm going to perform better, because before we don't have anything like checklist that would checkmate our activities and our progress. But now, with the introduction of the checklist, we are going to have a steady work that will checkmate our progress and then our performance, because this will make sure that WDC know what they are doing, and then they will act on accountability and then having transparency, because it will show how we are going, where we are going, and the progress we are making.
Indeed, this training has opened their eyes to many possibilities, and a lot is expected from them.
We expect to work like side by side in the sense that, being that they are in the community, and we will not say we are not in the community, but they have more eyes and ears in the community. So wherever they have a challenge, we are there to support, we are there to guide, we're there to mentor. So it's definitely something that we feel that we can work together to achieve and make sure that the Basic Healthcare Provision Fund is strongly being implemented, using the structure and using the implementation process and the implementation framework. We need to see more young people, more women, because there are a very, very, very limited number of women in the WDC. Within the percentage of the WDCs, I would say like 0.1, not even 1%, 0.1% of women involvement in the WDC. So we need to see younger people and also more women in the WDC structure.
After the training, we are able to understand that we need to translate both the checklist, the scorecard, and also other documents into Hausa, which we have already started the move and the process, because once we translate it into Hausa, it will be easily usable. As the consultant, I'm also proposing that we even translate it into Ajami form of writing in Hausa. It will be more easier for the WDCs to use, more than the Hausa language, which is part of our recommendation, and I know KanSLAM will do that by the grace of God.
As the Ward Development Committee chairman return to their communities, it is expected that the knowledge gained from this training will foster a more accountable and responsive healthcare system in Kano State.